All right, good afternoon, everybody. Everybody doing all right? All right, so today I wanted to invite Ashley Johnson over to come and talk with you all. She's in, what's the office title now?
It's pre-professional and exploratory
Pre-professional
programs, and I do the pre-professional side.
Yeah, so she's going to talk with you about all the pre-professional stuff.
Mm-hmm.
So for those of you who are thinking going to med school, dental school, PA school, optometry, the whole 9 yards.
I have them on a slide because
Yeah,
it's a lot.
it's a lot. She's the person you need to talk to, and one of the things that I mentioned to you earlier was that getting in touch with this office, if you haven't already, is very important. If you're thinking about, even if you're thinking about these types of careers, I know some of you haven't completely decided on your future, but certainly with a major in chemistry or biochemistry, these futures open up to you. So I am going to turn it over to her for about 30 minutes and let her engage with you in a presentation and give you an opportunity to ask questions. And so please give her your undivided attention.
Thank you. Well, I'm Ashley Johnson. I am the coordinator for pre-professional services here at USM. I know a couple of you already. So you may have already heard some of this stuff before, but hopefully for the majority of you, it'll be kind of new. So like Dr. Masterson was saying, these are the areas that I cover here at USM. So the idea is that you get your bachelor's degree from here, and then you may go on to a professional program elsewhere. So the areas that I currently cover are allopathic medicine, which is MD, osteopathic medicine, which is DO, dental medicine, optometry, pharmacy, physical therapy, veterinary medicine, physician assistant, and occupational therapy. I like to say all of those, even though it's definitely a mouthful, and I'm going to go over a little bit more of these in detail, but just because there's so many and I want you to know like what your options are. Like Dr. Masterson was saying, really as a chemistry major, it sets you up really well to go into any of these fields. So all of these are open to you as a possibility right now with your current major. So I'm going to talk individually about each of these, and then I'm going to go into more of what kind of services my office provides. But to get started, I know that sometimes I have students come into USM, and the only real types of medicine they've been exposed to are like doctor and nurse. So I like to make sure that you know kind of the differences in the areas that I cover to make sure you're making an informed decision about what you potentially might want to do one day. So if you're interested in being a doctor, a physician, there's a couple of different routes you can go. So you can go MD, which is the more traditional route. And I know that this has a lot of like words on it and information. I did send this to Dr. Masterson, and I'm going to let him know he's free to share this with all of you so you can refer back to it later, because I don't expect, and I'm not going to read the slides to y'all, but I don't expect y'all to read all of this right now either. But MD, Doctor of Medicine, is going to be your more like traditional, what you usually think of when you think of a physician. University of Mississippi Medical Center is an MD program. University of South Alabama, LSU, Tulane, University of Alabama at Birmingham. So MD is the oldest. It's over 100 years old. And what these doctors tend to do is diagnose and treat all sorts of things. So the example that I like to use to kind of describe the difference between these two is if you go to an MD for a stomach ache, they're going to provide you medicine to get rid of the stomach ache. That's the goal for them. If you go to a DO, and I'm going to talk a little bit more about that one, but they're going to want to know what is the root cause of that stomach ache, because they're going to look at you a little more holistically. Within Doctor of Osteopathic Medicine, the programs are essentially the exact same between MD and DO. The only difference is that Osteopathic Medicine DO has a required additional 200 hours of osteopathic manual manipulation. And what that means is kind of just what I was talking about, that holistic health. So they're going to look at how all of the organs in the body and everything kind of works together. And they understand that like if you have a stomach ache, it could be for a variety of reasons. It doesn't necessarily have one cause. Because of that, DOs typically go the primary care route after they finish up and go into their residency, whereas MDs tend to go the more specialty route. The closest DO is William Carey right here in Hattiesburg. There's also Alabama College of Osteopathic Medicine and VCOM, which has locations in Louisiana and Alabama, and a couple others. So that's being a physician. And then the length of school is after you graduate from USM, it does require a bachelor's. You would go on to 4 years of medical school, either route you go, and then you have 3 to 7 years of residency, depending on what you do choose to specialize in. So if you go the route of like being a primary care physician, that's going to be more like 3 years. If you go the route of being like a neurosurgeon, or you want to do something in cardio, that might look a little bit more like 7 years because it's more specialized. You need a little more training before you can start cutting people open, right? With that being said, I've got up here just a list of some different salaries, because even though all physicians generally make over $200,000, there is a bit of a variety there depending on like what specialty you choose and how much you make. I will say that how much you make, as it goes up in that, so do your hours that you'll be working. Like if you were a surgeon, you will not be working a 40-hour 8 to 5 kind of week. You will be working sometimes double than that some weeks. So the salary is a lot, but you're also going to be working a lot. So that's physician. Then we have Doctor of Medicine and Dentistry and Doctor of Dental Surgery. Even though some schools have different little codes like that, DMD and DDS, they used to do different things. They no longer do. They now have the same curriculum. So this isn't really something that y'all ever need to pay attention to when selecting your future schools. But hopefully all of you know what a dentist does. They're the ones that check for cavities, do fillings. You go to them hopefully twice a year to do those cleanings and things like that. An orthodontist, you still have to go to dental school, but you do need additional like residency after. Whereas with dental school, you have your 4 years here at USM, you go on, you do your 4 years in dental school. If you just want to be like a basic dentist, you go right into working. So there's no like residency involved. If you wanted to do orthodontia or some other specialty within dentistry, there would be additional residency as well. I included in Mississippi, dentists earn over $105,000. They are going to be more of that like 8 to 5 Monday through Friday, unlike physicians. And dental, like we're never going to get rid of dentistry. Like it's always going to be growing. One thing that is really unique about dentistry is that they are very heavily based in the community. So this is an area where in order to be a competitive applicant and apply to dental school, you do need at least 100 volunteer hours at the minimum in order to apply. And that's because dentists see themselves as part of the community. It's somebody that you go to multiple times a year. And so they want to see that you have a commitment to your community. So that's something specific that they require that the other programs don't. Then we have optometry, which again, this one is going to be hopefully something that you've heard of before, especially my people in the room with glasses. So this is going to be your primary eye and vision care provider. They're the ones that perform your eye exams, do all of the vision tests, like blow the air into your eye to see what the pressure does and all of that. We do not have an optometry school in Mississippi, so I don't really have a lot of optometry students currently, probably because of that, but it is growing. But the closest two schools are University of Alabama at Birmingham and Southern College of Optometry in Memphis. We actually had Southern College of Optometry here last week trying to recruit some of our students. This one, the schooling is very similar to dentistry, where the length is 4 years if you just want to go out and be a primary optometrist. This has a little bit of a higher projected growth rate, 9% projected growth rate before, that's actually supposed to say 2033. So over the next 10 years. And then that salary again in Mississippi, you're looking at over $100,000. Obviously with all of these, like nationally, that salary is going to be higher as you go other places and have a higher cost of living as well. So you'll see that too up there. Doctor of Physical Therapy. I'm going to talk about Doctor of Physical Therapy and Doctor of Optometry, which is my next slide, kind of simultaneously because people get these confused a lot. But Doctor of Physical Therapy is injury recovery, restoration of specific movements and muscles. So let's think about like people that get into car accidents and maybe they have surgery, and then once their leg is healed, they have to go back to physical therapy because that affected now the muscles in the leg, and you have to rebuild some of those muscles out. If you have a stroke as well, sometimes even like genetic disorders, genetic disabilities require physical therapy. There's all sorts of settings for physical therapy. You could be a pediatric physical therapist, you could be geriatric physical therapist, and pretty much everything in between. You can work in a hospital. You can also work at a private clinic if you wanted to do more like 8 to 5 work. Projected growth in Mississippi is 23% over the next 10 years, so very high growth rate. And then you'll see the salary is $96,000, so just under that $100,000 for Mississippi. The closest one is William Carey, just down the road, and then University of Mississippi Medical Center in Jackson. For both physical therapy and occupational therapy, William Carey is coming on the 21st for those, if y'all are interested. 21st at 4 p.m. I think I have that on a later slide if y'all want to hear more from them. The schooling is just 3 years, and then you get to practicing. So it is a shorter time frame to start in this profession as well, if that's something that y'all are interested in. So with this one, with physical therapy, you focus a little bit more on rebuilding muscles or just muscles in general. Whereas with occupational therapy, that one is going to be about doing certain movements. So for instance, let's say a person like breaks their wrist or something in like a car accident. They have to maybe potentially relearn how to turn a doorknob, right? So they have to have somebody that kind of teaches them, and it's a very like problem-solving profession too, because they might not be turning the doorknob the exact way that you are. They might not be turning the doorknob the exact way that they used to, so you might have to get creative with some of your solutions. Same with physical therapy as in occupational therapy. A huge setting is in pediatrics. You've got to think about all of like the kids with developmental disorders. Again, you're looking at like strokes, car accidents, things like that. Private practice and hospital settings, they're needed in both. Also, they do a lot of home health too. Because a lot of what they do is helping them get their patients back to like their normal everyday life. A lot of that involves like getting around their own home, maybe learning how to like zip a zipper on their pants again. So those things sometimes require home health. So that could be a setting for you as well. Currently there's options for a master's program, which is 2 years, and a doctorate program, which is 3 years. So you still have that option. William Carey is starting a new occupational therapy program in fall of 25. It's going to be a master's option. UMMC has a doctorate option up in Jackson. And most of them are kind of turning into doctorate programs, but you can still find some of those master's programs too. And you'll see there's a huge projected growth rate in this one, and the salary is very similar to physical therapy. You're looking at like close to 100,000, 94,000 is the average in Mississippi right now. Then we have pharmacy, which I know Diego is going to be my future pharmacist in the room. But pharmacist is not just like what you think of with pharmacy, where they're not always working like at like your local pharmacist. Yes, that's a really big part of the career, but you can do so much more with pharmacy than just work at like CVS or Walgreens or something like that. If you think about it, like if you are in like the ICU or like critical care unit, those doctors and nurses don't have time to wait for the hospital pharmacist on the first floor to bring them up medication. So there's also like a pharmacist in most of those units that's there ready to figure out how much medication a patient needs and give that medication right there. A lot of animals use the same types of medication as humans do, but obviously they need a different dosage. So there's veterinary pharmacists that exist to help figure out like the difference in those as well. So pharmacy has like a super wide setting. There's also like research you can do with pharmacy. You can create the medicines yourself. Chemotherapy is a kind of drug that pharmacists can compound, and so there's a lot you can do with pharmacy. The amount of schooling, you have to have a PharmD, so a doctorate, in order to be a pharmacist, but the amount of schooling really varies depending on the program. So William Carey has a very intense accelerated program on the coast, which is just 2 years and 10 months, whereas Ole Miss is our other pharmacy school in the state. They have like a more traditional path of 4 years. Ole Miss also has like more clinical rotations, so you do like a year at UMMC at the hospital, going rounding with different units, and then your final year you get to like pick your location and like what kind of pharmacy specialty that you want to go into, and then you go straight into being a pharmacist. In Mississippi, they make about $130,000, so they do okay in any of those. Doctor of Veterinary Medicine, this is working with animals, obviously. This one is, so in order to be a veterinarian, you kind of do a little bit of everything. So if you are interested in doing surgery, if you're interested in doing that primary care, wellness checkup, if you're interested in just like emergency medicine, as like a general veterinarian, you do all of these things, and like your day-to-day is very different depending on who your patients are that day. There are currently a lot of veterinarians expected to retire over the next few years in Mississippi specifically. So we're looking at a 20% projected growth in the next 10 years, which is really high. And then the length of the program is 4 years. You can specialize as a veterinarian, and that would require an additional fellowship. So if you wanted to be that primary care veterinarian that does the wellness, does the like spay, neuter, and the general surgeries and everything, you can go straight into that after you graduate. If you want to be like a specific like orthopedic surgeon for animals, which is a thing, if you want to be a cardio veterinarian or something like that, you just have to do an additional specialty in that. The closest school for us is MSU, but LSU, Auburn, University of Tennessee also have veterinary programs as well. Another thing just to mention is veterinarians really have to stay on their toes, because you never know what kind of animal you're going to see. Even if you work in like a small clinic, I mean, you might see a goose, you might see a cat, you might see a bearded dragon. You kind of have to know a little bit about the anatomy of all of those and be prepared to help any kind of animal, not just the cute, fluffy ones. Physician assistant, so this one is definitely growing. USM is actually getting a PA program on the coast in October 2025. That's when the program starts for the first time. So maybe by the time y'all get there, they will have been, they've had a couple cohorts already. But physician assistant is going to be pretty much able to do the same things as your normal physician here in Mississippi. One thing to note is that due to state laws, what you can do as a physician assistant varies a little bit state to state. So in Mississippi, you can be a PA and you don't have to have the supervising physician for 30 miles. So you can have your own practice as long as your supervising physician is within 30 miles of you, you're okay. In other states, you might have to have that supervising physician in the same clinic as you or in the same hospital as you. You might have to have your supervising physician sign off on like medications and things like that you do at the end of the day. So that can vary. The really cool thing about PA that I find that students tend to really like the idea of is that like with physician, like going MD or DO, you choose your specialty up front and then you're like stuck in it. That is your specialty forever. if you are a PA, you can hop between specialties. So say your first year, like right out of PA school, you want to do ER or surgery PA. You can do that. And then like if you decide later on you want something that's more 8 to 5, you can switch over to like dermatology or primary practice. So you have that flexibility there with additional like on the job training, but no like additional schooling. Huge growth rate in Mississippi because we are so rural. They're trying to like pack in those PAs to get more healthcare to more residents. And then this program is 27 months, so it's a little less than 2.5 years before you can start practicing. There's 3 programs in Mississippi, so including USM, there's also Mississippi College, and Mississippi State has a program as well. And then you're looking at like 130,000 average for PAs. So I just gave you all a lot of information about all of my different areas. I've got this common prereq list up here. It is really hard for some programs to identify like a standard prereq list. For med, for dental, for optometry, those prereqs aren't really going to vary from school to school, but if you look at PA or PT, they can vary a good bit from school to school. So again, I'm going to make sure y'all get this PowerPoint so you can review it, but you can kind of see I have the schools at the top just to kind of give you an idea. This is a good starting place. A lot of these prereqs though, you'll notice, with the exception of like A&P, I think most of these are already included in your degree plan for chemistry because a lot of them have to go up to biochemistry. A lot of them require those lower level bio 1-2, physics 1-2, which I know is required for the biochemistry emphasis. So, but yeah, you can look over that later. Just wanted to kind of mention that. There are several health student organizations that I wanted to mention too. American Medical Student Organization and the Minority Association of Pre-Medical Students, even though they have medical in the name, that doesn't necessarily mean that they're only open to medical students. Anybody can be in those organizations. Instagram is like the best way to follow and see what's coming up next. They all are very active on Instagram. We also have the Pre-Dental Society. Pre-PA Society is brand new, and then so is the Pre-Occupational and Physical Therapy Society, Pre-POTS. So those are all brand new. Follow them on Instagram to find out like when their next meetings are and things like that. It's really good just to like get connected to them, especially when it comes to like shadowing and observation hours. Sometimes other students are your best resource to figure out like who have you been shadowing and like sharing contact information and things like that. Another thing, I mentioned that dental requires volunteering, but honestly, most of the programs, like you do need volunteering in order to be a well-rounded applicant. And USM has a volunteer platform, which is volunteer.usm.edu. So if you have a volunteer place in mind already, great. But if you need help getting started on that, I highly recommend looking up the volunteer opportunities here in Hattiesburg. Some of them are even on campus. So you can find that. And there's some really good things on there like after school tutoring, soup kitchens, all of that. And this kind of brings me to what experiences should I get involved in. So with all of the programs I mentioned, your GPA is really going to let them know if you are able to get through their programs. Your experiences, your extracurriculars are going to let them know how you are going to be as a practitioner. So even though they don't necessarily say like you need volunteer experience or you need like work experience or things like that, you are going to have to talk about those things on the application through your essays. And it's just a good idea in general. You want to be a competitive applicant. You want to be well-rounded. You want to show them that you have the soft skills necessary to be a great practitioner one day. And they don't have to be healthcare related. So my advice is to start tracking all of your experiences that you do outside of the classroom now. Whether you work at Chick-fil-A, whether you are on an intramural team, it doesn't matter. Start tracking that. That way, when you go to write your essays in 3 or 4 years, you have something to refer back to, and you're not just trying to remember what you did your freshman year or 3 years ago. This is just an example experience log tracker. It just has some like basic information to like remind you about. You do not have to use this. If you want to use like the Notes app on your phone or like a Google Doc, that is fine with me. I just want y'all to keep up with what you're doing. And then I do have several group information sessions still coming up. I had the PA one yesterday, so it's not on here. But over the today and next week and the week after, I think, I will be, if you want more information about one of these, feel free to come. I will be talking a lot more in depth about each of these, as well as like the application systems. So feel free to pop into one or more if you're thinking of maybe multiple paths. And then I mentioned this earlier, the campus visits. So we do still have a couple of admissions recruiters that are going to be coming on campus this semester. We have occupational therapy from UMMC coming October 7th, so next Monday. We have William Carey's OT and PT coming together to talk about their new OT program and their PT program on October 21st. William Carey School of Pharmacy, I think they're actually coming to this class. I think we scheduled that. So they're going to come and talk to y'all on October 23rd. And then USM's PA program is coming on November 11th at 3 p.m. Now that they've been through the accreditation process and had their first like application cycle of students, they are making some changes for next cycle, so they're going to come and tell us about that. So feel free to come to any one of these. And then just to talk about, I do one-on-one appointments with students, so if you want more like tailored information just to you, we can talk about prerequisite courses. We can talk about what required experiences or just like general experiences. We can talk about your timeline and specifically map out when you're going to apply and start your program. We can talk about personal statement and essays once you get closer to applying, and just the overall application process. It's a very tedious, it's a very long process, and so I'm here to kind of help simplify that for y'all. I do have another event coming up on November 1st at Forest General. Their trauma services department is doing a Stop the Bleed event. So if you're interested in hearing from a trauma surgeon and learning, they have 3 different stations to kind of help teach you, community members, how to stop the bleed. So they have like a tourniquet station and like a wound wrapping station. There isn't transportation provided for this, but y'all can carpool or you can walk. It's not super far and there's sidewalks and everything, but you do have to sign up here. And then I send emails out not only with all of the stuff that I've already mentioned, but I also send out like when local programs do virtual open houses or in-person open houses, or even when like the national organization does like a virtual recruitment fair and they come and they have multiple schools talking about their application process and things like that. I try to share all of that and keep up to date with all of that for y'all so that y'all can have as much information as you want about the process of applying to your program. And so I share that through the email list here. So if you don't already get emails from Ashley Johnson, this is how you can sign up for that. And then this is my contact information. I'm really good with email. I can respond back within like a few hours. If you call me, I might not always answer. I'm quicker with email, but leave a voicemail if you do and I can get back to you. I've got the link to schedule that appointment with me. I use Bookings so you can schedule whenever like works best for you. And then as you get closer to the application process, I also have a Canvas page that goes into more detail on the individual applications, including like character counts for those, style of interview that they have, deadlines, whether they have rolling admissions or fixed admissions. I have all of that on the Canvas page as well. So I think I did okay on time, but does anybody have any questions? I can answer any kind of questions. Yeah.
So I was talking with
A couple questions.
and they said that like after you finish the class, ask your teacher to write your letter of recommendation from us, just so right then and give them our advisor the home. Is that something that you like heard of before, or that you think is around?
Yeah, I haven't heard of that before, and I would be hesitant to do that. Just because, like, if you were to do that, like, your freshman year, I do want you to, like, keep up those relationships with your professors, especially the ones that you really connect to. But when you do the application, it asks for their emails, and then you send them the recommendation letter that way. So I would give them more of like a 2 to 3 months heads up instead of like a couple year heads up, just because they might forget. Yeah.
I guarantee you we will. For
Yeah.
It's just the way it is.
Yeah. But that's a good question. It is good to like develop those relationships with your professors early on. Just because I know some professors, like, if you don't go to their office hours, if you don't ever talk to them, all they really have to go off of is just going to be your grades. And you want a better recommendation letter than this person made an A in my class. Any other questions?
I will say that if you go to any of the events that she has listed, or if you go to meet with her with a one-on-one, I will count that as one of your activity 2 assignments. If you haven't already done that, that will be fine. Just make sure you take your activity 2 assignment sheet with you so that she can, or whoever can sign off on that. So I would certainly count that. There's some other things coming up. We'll have some additional visitors. We're going to have people from International Study Abroad Office come and talk, and meeting with them as well can also count for that type of an activity. So yeah.
Awesome.
Anything else, Ashley?
Yeah, I think I'm good. Does anybody have any last minute questions? You are welcome to share this PowerPoint with them, because I know I have
I will.
some QR codes and some dates and stuff. So yeah, feel free.
It will be published on my YouTube channel as part of today's deal. So
There you go.
you made it to YouTube.
Well, thank you. I appreciate it.
Thank you very much. Appreciate you coming.
Yeah.
I hope to see some of y'all soon.
Have a good afternoon.
You too.
For those of you who have a device open, let's do a little bit of rudimentary research. So she talked to you about 2 types of doctors. What were those 2 types? Physicians. MD and DO. So there are myths out there about MDs and DOs. One of the myths is that one is better than the other. That's a myth.
Is it?
It is. And we're going to do a little bit of research here to debunk it. The only way that you can truly measure whether or not some profession is better than another one is to look at their health outcomes. So I want you all to Google a little bit. We're going to do some very rudimentary research. This isn't in depth. And let's see, is there any real difference between an MD and a DO, or are there any studies out there on MDs and DOs that show a difference in health outcomes? So take a couple of minutes and let's just do a little bit.
What do you mean when you say health outcome?
Just type in health outcomes and see what you come up with. Health outcomes are things like death rates, hospitalizations, readmissions. They send you home and you come back with an infection. Those are health outcomes. So patients who see MDs versus DOs, do we see differences, any kind of significant differences in health outcomes? While you all are doing that, I'm going to go ahead and hand out the attendance card. So, what kind of references are you all finding? Not the outcomes yet, just the types of references. What is Google showing you?
Gemini.
Huh?
Gemini.
Gemini outcomes. Okay, what is that? That's artificial intelligence, isn't Gemini artificial intelligence? So that's the summary, right?
I'm on
So-
MedPage today.
You're on what?
MedPage today.
MedPage Today. Okay, so we're seeing things that Gemini has summarized for us. Webpage, what would you say?
MedPage.
MedPage Today,
UCLA Health.
UCLA, okay.
National Library of
WebMD. What are you all finding over here? Cleveland Clinic, UCLA. Nobody's finding anything from the National Institutes of Health? We'll have to do a little more digging, right?
National Library of Medicine.
National Library of Medicine, okay. So we're finding a variety of different sources. How many of you are these sources on the first page of your Google search? All right. That's usually where we stop. So are we really doing research? Not really. We're kind of doing a little bit of a literature review. We're seeing what other people have said, and we're going to kind of take it at face value, right? But it sounds like we have at least some credible sources, right? So we can start there with some summaries. Any differences between an MD and a DO in health outcomes?
Not so
No.
No, not so much. So why do we have two?
They work differently.
They are trained differently, as she mentioned, right? A little more holistically, a little more treating the symptom. And yet, there's no real difference in health outcomes. So what does that tell us about this? Or what could it tell us about this? I'm sure the doctors, if I had them here, would argue intently with me. Right?
Money.
There might be a difference in money. They might get paid differently. I don't know that that's true, but it could be.
I don't think it's like interest, like how they want to approach it.
Okay. What else?
How patients want to be treated.
Like how patients want to be treated.
Or
Okay.
how they practice.
How they practice. Okay. Should we as a country have both DOs and MDs if the health outcomes are exactly the same? I don't know the answer to that question. I'm just asking what you all think.
Possibly.
Possibly?
Maybe.
Maybe? Right? Right, I mean, we're saying in one that the MD is more of this, that, and the other, the DO is more of this, that, and the other, and yet the health outcomes are no different. What that tells me, at least at the surface level, is it's irrelevant. So what do I do when I go to the doctor? I go to the doctor who can see me the quickest. I don't care if it's due afterwards or moved afterwards, okay? I'm gonna see the one that's the quickest because I know that likely the health outcome is not gonna be any different than if I see an MD versus a DO.
I think if you have like chronic health, you would prefer to go to a DO compared to an MD.
You might prefer, but if the health outcomes aren't any different,
I guess, but I guess I'm seeing it from when she said that they take a more holistic approach to find the root of the cause rather than just meds. If you have like chronic health, you will want to go to the root compared to just medicine.
yeah. And I would counter that. I'm not arguing with you, but I would counter that with, but the health outcomes aren't any different.
There are many other factors that affect the service. I mean, there are so many factors affecting the health outcome. So
Okay.
I mean, I feel like that also goes into what they're actually doing. What a medical doctor is doing, they could be actually doing surgery, whereas a DO might be just a general physician. And
Okay,
so
so
that's what they're doing.
Okay, so let's do another little search on that. That's an interesting point. Can DOs do surgery?
do DOs have residency?
I've had a DO touch me with a knife before.
They have places.
Do DOs do residency?
Huh?
Just like MDs?
They do.
I believe they do. Do dudes do surgery?
Yes.
Hopefully they don't do surgery, right?
Yes, they do.
Yes, they do. They do surgery. Or they can do surgery. Not every MD does surgery, right? My point is that we have these myths in our head, and I was certainly had these myths because I remember growing up when my mom would take me. So I went to the tribal health service. When I was growing up, I grew up in Oklahoma, I'm a member of the Cherokee tribe. We went to the tribal health service, and I remember there was an MD and a DO, and my mom always wanted the MD because they're the real doctors. I kind of believed that growing up, because that's what my mama told me, right? And now we just did a little bit of research, and we know that there's no difference in health outcome from that level of training. Are there bad DOs? Yes. Are there bad MDs? Absolutely. Just, we could do research on that, right? If we looked at research on, what else might we look up? We looked up health outcomes, we've looked up so whether or not they can do surgery. What else might we want to look up if we're thinking about taking a path?
What like specialties usually fall under MD?
All right, so we might want to look at specialties. If I'm looking at specialty, is that more likely going to be an MD kind of thing or a DO kind of thing? We can look at that.
Residency match.
Residency requirements, you could look up that. We could also look up things like, you know, are there any studies out there on malpractice lawsuits difference between MDs and DOs? Right? So what am I trying to get you to think about here? I'm trying to get you to think about doing research in your future career tracks if you're thinking about medicine. Right? Because a lot of you will think about, well, I really don't want to go to the DO route, or I really don't want to go the MD route. I've heard this, I've heard that. You've got to do your own research. Okay? And that does not mean doing your own original research, using what's already out there. Okay? And there are a lot of myths. And it's easy for us to believe those myths. I certainly believed it because my mom told me when I was younger, we want to go to the MD, we don't want to go to the DO, right? And then it turns out that a good chunk of my time I went to a nurse practitioner. And so, and you could start to look at health outcomes with that as well, right? So there's a lot of data at your fingertips these days that you can use as you start thinking about your career trajectory. So what might be an advantage to choosing one over the other for you? This is a very personal question. There's no right or wrong answer.
For me, the residency match rates are a bit higher for MD compared to DO, so when I look at choosing between them, I like to look at the residency match.
Okay, that's good. What else? Some of you may want to stay in the area and the only option you got is down the road. And that's a DO school, right? Some of you may be thinking about location. Some of you may be thinking about the type of specialty you want to do, or if you want to do one at all. And so I think you need to start thinking about which track would be more likely for you.
So if you get a DO, can you work outside America with that license? Do other countries accept DO as a doctor?
I don't know. I don't know that. That would be something that would be interesting. So if you're thinking about moving to another country, how does that country view the different trainings? Certainly that's something that should be considered if you're thinking about.
Because I had
Design
never
somewhere.
heard of osteopathic medicine as this level of doctor before.
Mm-hmm.
So I had only heard allopathic doctor as real doctors. So this is
See? Yeah, we use that language, don't we? You had something you were going to say? No? Okay. So, yeah, I thought we would do just a quick little research on that and have a little fun with it, because I've always found that kind of interesting, that we have our own personal experiences with these words and these terms, and yet we just kind of accept it. All right, so I uploaded for you some information on historic trailblazers. This was an entire issue of Chemical and Engineering News this week. I only gave you the historic trailblazers, not the ones that are currently there. Many of these people have since passed on. This particular issue of Chemical and Engineering News was devoted to one type of group.
Latin.
Pardon?
Latin.
Latin. Yeah, they were all, in some form or another, connected to Latin America. And so I wanted to show that people from all over the world, as you all are well aware, have contributed significantly to the field of chemistry or biochemistry. And so there were several of these individuals, right? One of them so long ago, right, that it had to be a painting, not a photograph, right? But certainly, I'm hopeful that the artist was good and gave an accurate description. So what can you tell me about the readings that you saw here in these short snippets? What was your take home?
Reading on Sarah Stewart was kind of cool. How she made vaccines for children. That's a big deal.
That is a big deal. There's a lot of people alive today because of that, aren't there? Yeah, that's a big deal.
For some reason, chemists, even after working for so long, they still have hair on their head, while I've seen physicists not have.
We'll just turn our head towards a little better. So. Anything else?
A lot of them made a lot of their discoveries doing extensive research in their practice.
That's certainly true. Absolutely. It did a lot of significant stuff.
It's like all of these people's life work contributed to that regaining of the birth control.
Okay, so birth control definitely had its role in Latin America, or from people from Latin America. In fact, there was a very famous chemist who was involved with it. His name was Carl Gerasi. You probably read that name in there when we were talking about Louis Miramontes. I guess I'm pronouncing that right. I'm probably butchering it, and I apologize. Carl Gerasi was a very famous chemist who was at Stanford most of his career, actually worked at Syntex with this individual, and when the oral contraceptive was synthesized. And so some people claim that Carl Gerasi single-handedly is responsible for the sexual revolution of the 1960s. Probably some truth to that, right? But nonetheless, we don't need to debate those issues, but yet these were significant milestones along the way in chemistry. What element was originally thought to have been discovered by one of these individuals? Vanadium. Vanadium, yeah. So vanadium was certainly listed. Anybody know what they said about vanadium, why it's important?
They used it in a lot of bullets, right?
It is a very hard metal, right? It alloys very well, and it gives you properties for things like ammunitions and armaments and things like that. So vanadium is definitely in that area. So each and every one of these individuals contributed significantly to our history, and so I found it very interesting to read through it, and I hope you did as well. I also gave you a video from another former Golden Eagle. Anybody remember her name? First or last? Caitlin. Yeah. So Caitlin graduated a couple of years ago, actually did most of her research with who? Matthew Donahue, did a lot of organic chemistry. And she ended up going where? She got accepted to graduate school. Anybody know where? If I'm not mistaken, I believe it was Rice. So ended up going, I believe, to Rice, if I remember right. So Caitlin had a very interesting story in terms of her research. Anybody remember any of those pieces? She started very early on, started kind of where you all are. She actually came to USM prior to us having Chemistry 108. So I didn't get to work directly with Caitlin too much, but I did get to know Caitlin at a conference. So I went to a conference. Caitlin was also there presenting her research, and I was very impressed with the level of the research that she was able to present. And so, don't remember, it's been a while since I've actually watched the video. Did she talk about her conference visits at all? I don't think so, maybe not. But she was here during COVID, and she also had an internship during COVID that she was doing some stuff. She talked about that as well, right? So some very interesting work. So we're always able to find ways to get things done even during pandemics. It's just things get switched around. Hopefully we won't have another pandemic in my lifetime or your lifetimes, but nonetheless, chemists play a very profound role in those types of things in the world too. We all have vaccines now because the technology developed by chemists and biochemists as well. So, very, very important work that we'll talk more about later. All right. On your note card, like always, on one side, print your name and put your ID number, and on the other side, just tell me something that you took away from today's lecture, from having Ms. Johnson here to talk to you about pre-professional.